Thank you, Dr. Rogers. Good afternoon, everyone. My name is Alba Zevallos. I am an MIS Bariatric Surgery Research Fellow at Northwest Hospital. Today, I'll be presenting our abstract entitled Increased Stable Line Leak Rates Following Roux-e Analysis Comparing Roux-e versus Roux-en-Y Gastric Bypass Conversion and Primary Sleeve Gastrectomy. Here are disclosures. Sleeve gastrectomy is the most common bariatric surgery performed nowadays, with excellent short-term weight loss and improvement of comorbidities. However, some patients may experience long-term insufficient weight loss, weight regain, and de novo GERD. The most common revisional procedures after sleeve gastrectomy failure are conversion from sleeve to Roux-en-Y gastric bypass, followed by re-sleeve. For the aforementioned, we aim to compare 30-day outcomes between re-sleeve and primary sleeve gastrectomy, and between conversion from sleeve to Roux-en-Y gastric bypass and re-sleeve. Patients who underwent re-sleeve and conversion from sleeve to Roux-en-Y gastric bypass were identified with procedure type variable. We included patients from 18 to 65 years old who underwent laparoscopic robotic approach, and we excluded emergency cases and those with missing data. We performed a propensity score matching analysis with 23 preoperative characteristics and comorbidities. Then we compare overall major complications and bariatric-specific complications. Using the MBSA-equipped database 2020-2021, we performed two analyses. In the first analysis, we compared patients who underwent re-sleeve versus primary sleeve, and in the second analysis, we compared patients who underwent re-sleeve versus conversion from sleeve to Roux-en-Y gastric bypass. In our first analysis, after matching our 23 preoperative characteristics, we included 182 patients in each group. In our second analysis, after matching our preoperative characteristics, we included 183 patients in each group. We found that when we compared patients who underwent re-sleeve versus primary sleeve gastrectomy, patients who underwent re-sleeve had higher rates of readmissions, reparations, interventions, and stable line leaks compared to patients who underwent primary sleeve. And when we compared patients who underwent re-sleeve versus conversion from sleeve to Roux-en-Y gastric bypass, we found that patients who underwent conversion had higher rates of blood transfusions, emergency visits, and conversion to open. However, the re-sleeve group had higher rates of leaks. In this graphic, you can observe the significant differences between procedure, and we can observe that re-sleeve has the higher leak rates with 1.7 compared to conversion with 0.8, compared to primary sleeve with 0.1. So we conclude that re-sleeve has the higher risk of leak compared to primary sleeve gastrectomy by 17-fold, and compared to conversion from sleeve to Roux-en-Y gastric bypass by 2-fold. In our institution, we would consider performing conversion from sleeve to Roux-en-Y gastric bypass in case of sleeve gastrectomy failure. Thank you. I'm happy to take any questions.